So after the baby learns to roll over, the baby begins to crawl. And for us, that crawling action is the beginning of integrating the core, which we activated and strengthened in our rolling patterns, to the hips and the upper torso. So I call it crawling. The more technical term would be alternating quadruped. Some people won't be able to do the alternating quadruped right away. They may have shoulder problems or a lot of problems in rotational stability. So there is a pre-alternating quadruped, and I'll demonstrate that. So once again, we want people to get better. Not everyone can do everything we're asking, but we can use our mind and we can reverse engineer and simplify some things. So I'm going to show you what's commonly called as a dead bug, which would be a simpler and perhaps less painful version for people that can't put weight on their hands, their knees, their shoulders hurt. And therefore you'll do a similar exercise, but you'll lay on your back. So here I'm using a long foam roller to make sure that I have to do a little bit of balancing. And then I can begin to crunch, extend. See? Right? Same thing here. I can use the other side, crunch, touch the knee to the elbow tip, extend. Do this in a controlled fashion. Don't just let your body fall. Once again, the slower you go, the better your stability is going to be, because obviously you have to maintain more stability. If you're wiggling and shaking all over, that's showing you that you have a lack of stability and that your body's trying to find muscles to hold you still. It hasn't quite figured out the right muscles to use in those basic motions. Okay, so that's kind of a pre-dead bug warm-up. The alternating quadruped that most people will be able to go right into is going to make use of a rubber band. I don't expect you to have rubber bands like this. You can have your stretchy bands that have a handle on each side, but make sure that they're long enough to loop around one leg. Okay, so you may have just a normal rubber band with two handles, but you will be holding it and making sure that it goes around one leg. Okay, this is a fancy rubber band that we use, and it's specialized for a lot of the exercises we do. So I'll show you a few different views of this. You don't need an RX pad. This actually makes the exercise more difficult, but it also provides padding to your knee. Okay, so I'm going to place my knees under my bottom and my hands under my shoulders, making my body into a more or less a tabletop. I'm going to place the top of my foot on the floor. Do not curl the foot like this. Put it down. Okay, if I do this, I'm now using my foot to try to hold myself up. I'm creating false stability by creating tension. I'm going to lay that down. I'm going to place a rubber band around my shoe. You'll find out if you don't wear shoes, the rubber band's going to snap back and hit you on the backside. So if you wear your shoe, the rubber band generally stays in place easier. I'm going to keep my head straight. I'm going to look up a little bit. And I'm going to start by using the opposite hand and foot. I'm going to lift up, press out. Knee to elbow. There's my crunch. Back out. That's one repetition. Let's go over a few details for this. When I do this exercise and when I watch my clients do this exercise, I want to be sure that they're not flaring. If I were to put a roller on their back, I do not want that roller to roll off. Hence, reference table. I want to keep my back flat, stable, out. Okay, when I do this, I'm not flaring my leg out here, I'm not rotating my leg, I'm keeping the lower structure just as it would be if I were walking or running. If your leg's flaring out, turning in, twisting out, it's showing you that you are lacking the basic motions or stability to hold that position, and you're trying to recruit other muscles. Okay? So top of the toe is flat, I'm in my tabletop position. My arms are not stretched out. I'm not doing a push-up. My hands are placed right under my shoulders, knees under my hips. I extend. Now I'm activating my glute, activating my core, tying it all together. Crunch the core. Touch your knee to your elbow tip. Extend back out. Breathe. Don't forget to breathe. And now I'll do the other side. So let's hop over, put that band inside. That one goes on the out. In a good tabletop position. Opposite arm and leg. Knee to elbow tip. Extend back out. One repetition. If you can't perform that sequence altogether, we can break it down into parts. And the parts might look simply like this. Go back to the side. Okay. If I'm really unstable, or I have shoulder problems, or anything else, I'll do one leg at a time. So I'm going to keep all 3 pillars on the floor and just choose one leg. Hold. Bring the knee up. And then come back down. Now, you see the problem, without the use of the arm, I should have shortened the rubber band. It's okay. So I can always break these motions down to what I'm capable of doing and then build them up. Okay? So I shorten the roller out, hold the leg straight, don't let it flare out. Back is flat, knee comes up, breath, back out, reset. Maybe I'll just do the left arm. Out, in, out, and back down. Okay? So, when you look at these motions, we can always break pieces down, perform that piece. When we become competent, we'll put the other piece back together. Okay, so then we'll combine the pieces and have the complete motion. Little common sense goes a long way. Okay, so that's alternating quadruped.